Well, the debate over access to new cancer drugs is heating up, with some pharmaceutical companies labelling Australia's approval process as one of the slowest in the developed world.
At the same time, the Pharmaceutical Benefits Advisory Committee is accusing some big drug companies of misleading patients with costly medications that have limited benefits. For more on this, Professor John Zalcberg joins us now from Canberra. He's the co-chair of the Cancer Drugs Alliance. Professor Zalcberg, thanks so much for dropping in today.
Thanks, Kimmy.
Let's start with the access to cancer drugs that Australians have at the moment. There's reports that say that they don't have as much access as they could. Where's your position on that?
I'm co-chair of the Cancer Drugs Alliance, and we're an alliance of consumers, clinicians and members of the pharmaceutical industry. And we came together because we were concerned that there was a very significant delay in patients in Australia having access to this new generation of cancer drugs. There are an enormous number of new drugs coming down the pipeline, and there are drugs that are available in other countries, and they're sometimes taking years to come to Australia. In some cases, they're not even getting here at all.
Why is there such an issue with access then, Professor?
Look, it's hard to know what the specifics are. We are a small part of the market, where Australia is about 1% of the global pharmaceutical market. But in the end of the day, we're a very developed country. We're a country that has a high quality of healthcare, and yet for some reason Australia does poorly when it comes to approval of all major drugs, particularly the new generation drugs and cancer drugs in particular.
There's a lot of talk around the cost-benefit analysis around high-cost drugs. The Parliamentary Committee Inquiry accepting submissions from Medicines Australia and also the Pharmaceutical Benefits Advisory Committee, as well as the Department of Health. Both the last two have said that they are concerned about cost-effectiveness, the value for money for some of these drugs. Do you think that's one of the reasons why there's potential hold-ups?
Look, it's absolutely important that we understand that we're not saying that we should pay any price for these drugs, but many of the drugs that we're talking about are actually game changers. Some of these drugs are effective in patients that never had treatments before. Sometimes they're the first in class, and increasingly now we're seeing patients that are cured of these diseases. The issues around cost effectiveness is that it's a model that's been used for many years, and in the end it depends on the detail of what you measure as cost effectiveness. From our perspective, what we need to measure is the value of these drugs, the value to the patients, the value to the community, and not just at a fixed point in time, but actually taking in the broad parameters of the importance of these drugs to people's lives and to the community at large.
Professor, how does what you're calling for here, what you're arguing for, how does all of that sit in a political and financial environment which is about reining in health spending and health costs?
Well, as you know, when Mr Tony Abbott was the Health Minister, he actually introduced a scheme which has largely been delivered, where the price disclosure leads to very substantial savings to the PBS. So in fact, even using government estimates now, the PBS is almost flatlined. A lot of those savings are delivering up to billions of dollars a year. And when Mr Abbott introduced that scheme, he introduced it on the basis that that would allow us to bring forward the innovative new drugs. Those savings are there, and what we now need to do is bring in these new drugs, which, as I say, in many cases will save people's lives.
Professor, how do you win a often sceptical consumer base around pharmaceutical companies and their motivations for getting drugs onto the market? Pharmaceutical companies have been losing revenue in Australia in the last few years, partly blamed on the loss of those exclusive marketing right patents being taken off certain exclusive drugs. Is there a part of the pharmaceutical industry that needs to kind of waylay consumer concerns about their motives for trying to expedite how drugs are put on the market?
Look, the view that I've taken as an oncologist, Kumi, is to say that at the end of the day, what we're here to do is to help patients. And we're not here to blame the PBAC, we're not here to blame industry, we're basically, as an alliance, saying we've come together because we've got the patient as the focus of what we're trying to do. And there will be changes required of government, and there may be changes required of industry. And what we want to do, and this is not going to be simple, and we recognise that, is what we want to do is sit down with government and try and work out the solutions. The status quo is unacceptable and it can't continue.
What changes do you think need to be made by government?
I think there's a number of things that we could do, and we are going to launch a white paper next week in Canberra to try and indicate some of these areas that we think are important. I think there can be much greater consumer and clinician engagement, and in fact, Minister Lee has recently moved to improve consumer engagement. I think we can do better with the existing systems, and at the end of the day, if the culture is about we are using taxpayers' money, how do we get effective drugs to patients in a timely manner? If that's the culture, then we'll find a way of doing it. We can look at new systems that are available overseas. We can look at bringing drugs on early, the breakthrough drugs, and then collecting additional information after they're on the market. There are a number of things that we could do, and that we would like to work with government and sit down and see if we can meet these challenges and move forward.
Professor John Zalcberg, we so appreciate you dropping in to chat with us today. Thanks.
Thank you very much.